Welcome back. Today we are going to discuss a very important topic, hydrocephalus. So, what is hydrocephalus? It's an increased CSF volume in the brain. So, we'll see flow of CSF. CSF is produced by choroid plexus, where then it goes to lateral ventricle through then it goes to third ventricle through foramen Monro. Then it goes to cerebral aqueduct through then it goes to fourth ventricle through foramen of Megendie and Luschka. Then it goes to cisterna magna, then it reaches to subarachnoid space, then at last it will be reabsorbed or drained to arachnoid villi. Absorption takes place. So this was all about CSF flow. Then we are going to talk about types of hydrocephalus. We have communicating and non-communicating, which is also called as non-obstructive or obstructive. Let's look into first communicating thing. All ventricles are enlarged. This is the basic difference in both obstructive and non-obstructive thing. So what are the causes in obstructive, non-obstructive or communicating? So usually there will be CSF production increase, and the condition is choroid plexus papilloma. It may be, or it may be due to reduced CSF reabsorption. There may be some excess production or reduced reabsorption. Usually obliteration of subarachnoid space happens, which is seen in tubercular meningitis. This is the most common cause in India. Then coming to other causes like pneumococcal meningitis, then interventricular hemorrhage, subarachnoid hemorrhage. It is the most common in all over the world for communicating and non-obstructing cause. And then we have leukemia infiltrates. So then coming to non-communicating or obstructive, we have causes like cerebral aqueduct stenosis, which is the most common among the obstructive causes. Then we have Thundi-Walker syndrome. It has triad, which is an important thing. There will be posterior fossa cyst, enlarged fourth ventricle, abnormal formed cerebellum. Okay, we'll make a separate video on Dandy-Walker syndrome, which is also a very important topic. You will see this video in the further days. Okay, then coming to Arnold-Chiari malformation type 2, it is also very important topic. It is also associated with meningomyelocele. Downward displacement and hypoplasia of cerebellum takes place, causing obliteration of cisterna magna. Then we have Walker-Warburg syndrome. Here you need to remember the mnemonic Hardy. Okay, Hardy. So mnemonic goes with the relations like hydrocephalus, agiria, retinal dysplasia. Then we have encephalocele. Coming to other causes, mumps meningitis, cerebral aqueduct stenosis will happen. Then intrauterine infections, mainly toxoplasma is the cause. Then we have cerebral tumor, which is examples for that is medulloblastoma or pilocytic astrocytoma. Then the other cause is ependyoma, which is related to fourth ventricle. These are like very important. I try to concise the causes. At least these many causes you need to know. Write down, mug it up for 2 to 3 minutes, then you will find it easy. Then coming to clinical features, just one line. Abnormal enlarged skull. There will be role of enlargement of skull increased. Wide and open sutures. Crackpot resonance or percussion. It is also called as like the 3-marker important question for undergraduates in pediatrics. You need to study detailedly for this crackpot resonance, how you are going to find it, and why it is felt on percussion. Then wide and open anterior frontonel. Then scalp vein distension, sun setting sign in eye. Okay, so coming to the treatment, we have ventriculoperitoneal shunt. So what is the complication of this shunting thing is like most commonly it leads to infection. Cause of the infection, staph epidermidis, which is cons. So best specimen you can get for investigation is tap from CSF shunt. That's it. Very important topic. Try to study this very properly because it is important in your pediatrics as well as coming to OBG thing. At the Viva we have the specimen called hydrocephalus. So here we learned what is the hydrocephalus. So related to CSF flow we studied, then what are the types, then their causes, then we studied about their clinical features, then finally we are done with the treatment. So that's it for the video. Subscribe, don't forget. Okay, have a great day.